Well, here in Alabama, nearly 1.5 million vaccine shots have been given out, and that number is growing every day.
On Monday, the number of people eligible for the vaccine is set to more than double. And that means people may find it harder to get vaccinated. But state health officials say they're already planning for a different problem.
Fox 10 News investigative reporter Brendan Kirby now joins us live downtown at the USA Health Civic Center vaccination site to explain all this. Brendan.
Yeah, Byron and Shelby, you're right. So far, public health officials have had their hands full just trying to keep up with the demand. But they expect that within a matter of weeks, they'll have the opposite problem. Alabama State Health Officer Dr. Scott Harris says polling commissioned by the state shows as many as a third of residents are hesitant to get the vaccine. He says there are many reasons.
Clearly, that comes in many different flavors, and you have people who are just hardcore anti-vaxxers that you're never going to reach. You have people who are mistrustful of the government and who don't believe this. Maybe this is a real thing, or don't believe the reasons that we're having a vaccination program.
Then there's folks with legitimate questions that simply haven't been answered yet, Dr. Harris says. For the first time this week, the Alabama Department of Public Health started breaking down vaccination numbers by county. In Mobile County, 23% of adults have gotten at least one shot. It's 22% in Baldwin. You can see how the rest of the counties in southwest Alabama stack up. Reaching the reluctant may prove to be the biggest hurdle to herd immunity. Mobile resident Jonathan McManus says he doesn't expect to get the shot anytime soon. He cited the infamous Tuskegee syphilis study, in which investigators failed to treat or inform infected African Americans enrolled in the study.
We don't know exactly what's in the vaccine. I don't feel like the government has given us a reason to trust it as much, especially because of the past events. So I would like to see the outcomes of the vaccine before I get it myself.
But Kenneth Richardson says he's already gotten the vaccine and has no qualms.
It's the only responsible thing to do. If we don't take initiative in order to help not only ourselves and family and other people, who will? Once I looked at all the data, I was confident that there was nothing to be worried about.
And Dr. Harris says that because there are different reasons why people are reluctant, a one-size-fits-all communication strategy won't do. He says the state needs to find multiple ways to convince people that the vaccine is safe. Reporting live from the Mobile Civic Center, Brendan Kirby, Fox 10 News.